us about the quote sinus headaches end quote and why that may not be the correct diagnosis for some people?
People are having this pain or this pressure or this fullness in their face. And a lot of people don't interpret that as headache. They interpret it as sinus because they've been told, well, that's where your sinuses are, which is true. That is where your sinuses are. The problem is just because you're having pain or pressure in that location doesn't equal infection. And that's where I think things go wrong, is because people will, present, they'll say, I have a sinus headache, I've got a little congestion or postnasal drip. And the assumption is, it's an infection, here's your antibiotic, and they feel better in a few days and they think, well, great, that antibiotic worked, I know what works for me. The problem is, so there was actually a study in JAMA where they looked at people who came in with a main complaint of sinus headache, and then they actually did the appropriate workup, whether it was a nasal endoscopy or CT or whatever it might have been. And 88% of people who had recurrent sinus headaches as the primary complaint actually met criteria for migraine. But if you tell people that, again, mouths drop, they will even potentially get a little upset with you for suggesting that they have migraine. And it can be a difficult and delicate topic.